So mantle cell, there's a lot of interesting things happening in mantle cell at the moment. So the late-breaking abstract for mantle cell is one of the mantle cell abstracts. Actually, it's the first analysis of the SYMPATICO study. And SYMPATICO is a randomized comparison of Ibrutinib with either Venetoclax or placebo in patients with relapsed or refractory mantle cell lymphoma. The study has been going on for the last 5 or so years, and this is the first time we've seen an efficacy readout. The covalent BTK inhibitors like Ibrutinib are considered standard of care at the moment for relapsed patients with mantle cell lymphoma. And we've seen a lot of new covalent BTK inhibitors such as acalabrutinib and zanubrutinib emerge in this space, which, because of their favourable safety profiles, have largely, at least outside the US, displaced Ibrutinib in terms of the choice of therapy. However, the SYMPATICO data gives us reason to ponder, because the headline result, of course, is that there was a large PFS benefit in favour of the combination. The hazard ratio was 0.65. So in other words, 35% reduction of disease progression or death in patients who were randomized to receive Venetoclax in addition to Ibrutinib. And that translated to an improvement in median PFS of approximately 11 months from memory. I think about 22 versus 33 months if you got the combination. It did come at the cost of increased toxicity. And I think given the magnitude of benefit and the randomized design, it does make a compelling case for the use of the combination of Ibrutinib and Venetoclax in patients with relapsed and refractory disease. There are a few other interesting mantle cell lymphoma abstracts emerging at the meeting as well. We're seeing interesting combinations with bispecific antibodies. So there was an interesting abstract for combining mosunetuzumab and polatuzumab vedotin, for instance, in mantle cell lymphoma, and certainly the efficacy appears encouraging and more than you would expect for mosunetuzumab monotherapy. And I think that gives all of us a bit of food for thought in terms of how we are combining these novel agents together and coming up with novel treatment strategies that are more appealing for patients with relapsed and refractory mantle cell lymphoma.